tobacco and drug abuse. Now I'll call upon Ms. Akesheva, the regional representative of the UNODC, to just share with us the global campaign that is out there to reduce the abuse of drugs and the spread of COVID-19. Over to you, Ms. Akesheva.
Thank you very much. Honorable Minister of Social Development, Ms. Lindiwe Zulu, Ms. Henrietta Bogapana Zulu, Deputy Minister of Social Development, Mr. Linton Mchunu, Acting Director General, Department of Social Development, Ms. Connie Nsumalo, Deputy Director General, Ms. David Beyer, the Chairperson of the Central Drug Authorities, ladies and gentlemen, all protocols observed. Let me start to thank on behalf of the United Nations family in South Africa, the Department of Social Development for organizing this event to commemorate the International Day Against Drug Use, against drug abuse and illicit trafficking, and also to use this opportunity to engage into discussion on the progress in addressing drug abuse in the country. I am very pleased to present today the global drug use trends and key findings from the 2020 World Drug Report, which is being also launched today as part of the commemoration of the World Drug Day. Drug use around the world has been on the rise in terms of both overall numbers and the proportion of the world's population that uses drugs. Around 269 million people use drugs worldwide in 2018, which is 30% more than in 2009, while over 35 million people suffer from drug use disorders. The impact of the drug expansion is visible in the increased number of persons who died because of the drug use. The World Drug Report refers that in 2017, 585,000 died in relation to the drug use. And that is increasing more in the developing countries than in developed countries, where less resources are available to address the drug problem. Globally, the market is becoming more complex than a decade ago, challenging government responses to the drug problem. While in the past, heroin dominated the non-medical use of opioids, the illicit opioid markets in many countries have become more diversified, with pharmaceutical opioids becoming available. There is increased number and combination of substances in the market. By now, there are 950 new psychoactive substances available in the market as compared to 282 under international control at the end of 2019. While not all NPS develop their own market, many are mixed with other substances, making drug use more harmful, public health responses less targeted, and law enforcement less efficient, because even testing for single substances require much more sophisticated equipment. There is a significant increase in the use of cannabis worldwide, and there is, of course, a public concern that the private sector likely to advocate for private business interests over public health interests. Large tobacco and alcohol corporations are investing in the cannabis industry. Such developments do raise concern that the revenue and profits are likely to dictate the course of the cannabis industry rather than the issues of the public health. While the reports show that the drug problem is bigger and more complex today than it was like 2 decades ago, and despite that many declarations agreed at the international level to resolve the problem, the actual response of the international community is weaker today. The UNODC 2020 World Drug Report that shows that globally, only 1 in 8 people with drug use disorders have access to treatment services. Moreover, while 1 in 3 drug users is a woman, women continues to account for only 1 in 5 or less people in treatment. More men than women are arrested for drug-related offenses. However, women face more challenges in the criminal justice system, higher level of stigma, since women are seen as a contravening the traditional roles of mothers and caregivers. That continues when women go out of prison. Women who are in prison for drug-related offenses often suffer from substance use disorder, psychiatric disorders, and a history of physical and sexual abuse. The World Drug Report warns that the economic downturn caused by the COVID-19 crisis has the potential to worsen levels of drug production, trafficking, and use. The crisis may worsen the socioeconomic situation of vulnerable groups, who in turn may increasingly resort to illicit activities as a coping mechanism to compensate for the loss of the illicit income and employment. Once restrictions related to COVID-19 are lifted, economic shocks may also prompt an increase in drug consumption, as observed in the past. Pairing drug-related programs with the development intervention that the government is launching to contain the negative consequences of the crisis can help prevent a possible further increase in the number of people with substance use disorders. Ladies and gentlemen, the theme of this year's International Day Against Drug Abuse and Illicit Trafficking is Better Knowledge for Better Care. It highlights the need to understand better the dynamics and factors related to drug use and to propose solutions that are balanced, health-centered, and based on scientific evidence. In order to understand the challenges faced by women who use drugs, UNODC and Sanput conducted a needs assessment in 4 cities of South Africa, in Pretoria, Johannesburg, Durban, and Cape Town. The results of the study revealed high level of trauma and sexual violence experienced by women, coupled with the insufficient access to health services, unacceptable violence by law enforcement, and abuse of human rights. Similar challenges are faced by women who use drugs in other countries, and the World Drug Report provides an overview of the main reasons behind that. People who inject drugs are often subject to marginalization and stigmatization, which creates social and economic barriers to accessing public health services, especially harm reduction services. The National Strategic Plan on HIV includes evidence-based interventions such as opioid substitution therapy and needle and syringe programs. However, the coverage is very low. We appreciate that the national OST guidelines and the implementation plan has been drafted and encouraged to endorse it and allocate sufficient funding. One of the barriers for access to the OST is the high price of methadone. In South Africa, methadone is not included in the list of essential medicines for the maintenance therapy, and the price is approximately 10 times higher comparing to the price in other countries. Removal of these barriers will allow to scale up the services and enroll more people in the treatment programs. 2 core principles of 2030 Agenda for Sustainable Development are to ensure that no one is left behind and to reach the furthest behind first. People who use drugs are some of the first to be left behind in almost all circumstances. Let me conclude by congratulating the Department of Social Development with successful completion of the National Drug Master Plan. During the current time of crisis and uncertainty, it is very important to have a clear vision about the national goals to be achieved. A strong leadership is required to guide the implementation of the plan, and in this regard, I encourage to strengthen the mandate of the Central Drug Authority. As the drug markets are becoming increasingly complex and the COVID-19 pandemic poses new challenges, there may be a need for adjustment in the plan in order to address emerging needs. I reaffirm that UNODC stands ready to assist the government of South Africa. The day today is a day to show solidarity. Let's support drug users. Let's not leave it just up to them to choose a healthy lifestyle. Let's use the whole government and whole society approach to support them in this way. Thank you very much for your consideration. Bye-bye.
Thank you.